Many thanks for staying with us. It's still the conversation, and of course, you know how we do it on this segment. Of course, it's the Lagos segment, and we're looking at something very, very critical. And what more can be more critical than our health? We are focusing on public health and citizen well being. And our topic for discussion is improving healthcare through health insurance. We have many people out there who do not understand how this works and who don't even know about Ilera Eko here in Lagos. But we have someone capable. We've been talking, and do you know that there are doctors who don't even see patients? That's what I just learned today. Okay, we have Dr. Olugbenga Fadipe. He's the head of Ilera Eko Medical Operations, Lagos State Health Management Agency, and he will be, taking us through the Ilera Eko, LASHMA, and what they all stand for. Dr. Fadipe, you're welcome.
Thank you very much. Good morning.
Okay, let's begin, of course, with the basics. What exactly is the Ilera Eko scheme, and what prompted the introduction of it?
All right. So, in 2015, okay, the lawmakers at the time, they met
in 2015.
2015, okay. The lawmakers at the time met together and said, okay, they wanted to ensure that residents of the states, have access to health services, and not just health services, quality health services. So that law was made. That was in May of 2015, and that law was termed the Lagos State Health Scheme Law. Okay.
Lagos State Health Scheme.
Lagos State Health Scheme Law. Now that law established three things. It established the agency, which is the Lagos State Health Management Agency, established the Lagos State Health Scheme, and then the Lagos State Health Fund. Okay, those three together, are supposed to drive access to quality health services in Lagos State.
Okay.
All right. So, but it took some time before it took off. All right. Operations fully started in 2019, but it became entrenched in 2020. All right, where we started with the public servants working for the civil service in the states. They were the first to be brought on board before we now had the general populace joining. So Ilera Eko is the social health insurance scheme of the states. Okay. The Lagos State Health Scheme is supposed to be the umbrella scheme that regulates health insurance in Lagos State, period. So whether it is private health insurance or social health insurance, that's the umbrella.
Oh, okay.
So under the Lagos State Health Scheme, you have the private health insurance and you have the social health insurance.
Okay.
So this private health insurance, as you know, is run by the private HMOs in the states. Then you have the social health insurance, which is now named Ilera Eko.
Ilera Eko.
Yes, so it means the well-being of the state. Eko is Lagos, isn't it?
Yes.
So Ilera is well-being. So you have the well-being of Eko, which is the well-being of Lagos State. That is that's basically the definition of Ilera Eko.
Okay, so do we still have the likes of the private HMOs in Lagos?
Yes.
Now that there's the Ilera Eko.
So the private health scheme is still going on.
Okay.
Like I said, the Lagos State Health Scheme is an umbrella for both private and social.
Okay.
Okay. It's still ongoing. All right. Even though that law that was promulgated in 2015 stated that health insurance is mandatory for every resident of Lagos State. That means if you reside in Lagos, whether you're working or you're not working, whether you're self-employed or working for someone, you must have health insurance. Okay, so that is what that law says.
Okay, so how does LASHMA now monitor that to ensure that everybody has a health insurance?
Okay, so
especially those in the informal sector.
Yes. So you have to understand that there are laws and there's enforcement. Two parts of it.
Okay.
We have a lot of laws that are, for want of a better word, lax in that there is no enforcement for those laws. So people know they exist or may not even know they exist. So people just do as they want because the law is there. Now, in 2024, July 16 to be exact, Mr. Governor, Babajide Olushola Sanwo-Olu, so he passed an executive order. Okay. That executive order was to strengthen the existing.
I saw a word mandatory
yes.
in that executive.
So initially, I did say that the Lagos Health Scheme law says that everybody in Lagos State, as far as a resident, must have, is mandatory already from that law of 2015. So the executive order only speaks to that law, to strengthen that law, to say, okay, everybody now, unlike, you know, what the initial law says is that health insurance. So it could be private, it could be social, it doesn't matter.
Yeah.
But now the executive order is saying that everybody has to have social health insurance. Okay, you have to have social. So that means you have to have Ilera Eko, basically. That's what it's saying. It's no longer health insurance, whether private or social. Now you have to have social health insurance. That was passed in 2016. But of course, the law, the executive order also says that public awareness has to be done to ensure that people are aware of this before enforcement takes place. Okay,
fantastic background. At least you have clarified, you know, that okay, we still have Ilera Eko, and of course the private HMOs still exist. So let's now translate into, you know, everyday healthcare for the average Lagosian. Now, we want to know how accessible is this Ilera Eko scheme across different local governments of the state?
Okay, so it's very accessible. The agency has offices all over the different divisions of the state. We have divisional offices in every single division. As you know, Lagos is divided into 5 divisions. So
sorry, I'm just receiving a message from my producer that we will need to go on a short break now. And when we come back, the conversation continues. Sorry, Dr. Fadipe. We need to go on a short break now.
Not go that level. It's just, you're taking me on the spot. Is it not during the Oduduwa's time? It's a long one. I cannot give you the exact date. Okay, Lagos is over 40. It's over. I think it's over 60 years now, if I'm not mistaken, or 50.
Honestly, I can't recall or tell you so year. So Lagos have been long existing, so I don't have much idea when it exists or when it created.
I need to know that one for sure because I stay in Lagos, but I don't know when Lagos was created.
Well, my business is that one.
Are you stay in Lagos?
Yes, I don't know. I don't want to mention Independence Day. Or was it created before independence? I don't know.
I don't have an idea.
May 27, 1967.
I don't know.
Why?
But I was born in Lagos. I don't know about that one because I just came to Lagos of recent.
I can't remember, but I know something I forgot, but I have it in the mind, but I just forgot.
1967. Which day? I can't say, sorry. But Lagos was created in 1967. After Calabar was Lagos.
May 27, 1967.
Many thanks for staying with us. It's still the Lagos segment of the conversation. And just before we went on that short break, we're looking at the access and coverage of Ilera Eko. But before we went on that short break, I asked a question that how accessible is the Ilera Eko scheme, and how does it go around the 5 divisions or the local government in Lagos State?
Okay, so I was saying earlier that it's quite accessible. On one side, we have divisional offices in each
divisional offices. Okay.
In all divisions of the state.
In all divisions, on the 5 divisions.
So we have divisional offices in each of the 5 divisions of the states. Apart from that, the hospitals that we partner with, is also spread around every single part of the state. We work with both private and public health facilities. Okay, so it's quite accessible. So if someone wants to subscribe, actually it's not an optional thing, really. If you go by the law and the executive order that is now, backing up the existing law. Okay, it's just supposed to have Ilera Eko. So it's expected that you would either approach any of the divisional offices, you come to our head office here at Ikeja. You can also call our toll-free lines. We have, our hotline. You can call that. You can reach us on our social media handles. You can chat us on WhatsApp. We have several channels of communication that you can reach us on, and we would let you know how, you can subscribe onto the plan. Yes. So it's actually quite accessible. Okay.
Yeah. You spoke briefly earlier on about eligibility of those who can, enroll on this scheme. How important is health insurance to people? Because now that we know that both the formal and the informal sector, can enroll, how important is it for people generally, especially for those in the informal sector who say, anybody can die at any time, why do they still have to put their money in something they are not even sure they're going to use? Okay, so how important is it?
Okay, so if I go by the statement you made, when you said someone said anybody can die at any time, that is very true. But the majority of people do not prepare to die. We always prepare to live. We don't prepare to die. That's a reality. Because there's also a saying that nobody hears the date of their death and the person will be happy. There's a saying in Yoruba. It is said in Yoruba that, you are not to tell someone.
You can say it in Yoruba because I
exactly. So the thing is, like I said, we don't prepare to die, and the reality is that we are so busy with living that we forget that there are things that can happen outside our control, and illness, injury, accidents are one of these things that can happen outside our control. And as we know, healthcare costs money. Okay, we say it's health, but it costs money. And what we know for a fact and from available global data is that the cost of healthcare increases every year. Okay, the last time I checked, the WHO data says in 2017, for instance, 10% of the total global spending was healthcare only. 10%, everything that was used in the world, 10% of it was for healthcare alone. That's a lot of money. And it increases every year. So when we have a country like Nigeria, where we are resource constrained, okay, we have a lot of people who don't have disposable income, when they have problems, an illness comes, an accident comes, an injury comes, how will they get treated for that thing? Do not forget, some of these injuries or accidents do not necessarily have to kill the person, but they can damage the person to the point where they become useless both to themselves and society, and their quality of life becomes very poor because they can no longer, make revenue for themselves and for their family. We don't want that. This is where health insurance comes in. So it's like you are planning for a rainy day, even though, like I said, nobody plans to get injured or to die, but you plan for a rainy day. So when you subscribe to a health insurance plan, what it means that in the event of anything I mentioned, injury, accident, or illness, then you can access healthcare services that you require when you require it without having to pay any amount of money. Okay? And because we realize that majority of the spending for healthcare is people paying out of pockets. and more people are unable to afford it because people's disposable income keeps dropping every single time. So if 10 people were able to afford healthcare yesterday, today it probably dropped to like 7. You know, I'm just saying, and it goes down as you go on. So to prevent that and make sure that more and more people can access healthcare services when and where they require it, this is why health insurance is there for.
Okay, does health insurance now, looking at, the one in Lagos, I'll keep referring to it because we're in Lagos, does it cover everything beyond consultation and of course, what's it called now? Medications?
Okay, so there is no health insurance plan. Okay, so under health insurance, you will have a plan.
Okay.
This plan will specify some services that you are entitled to when you visit the hospital when you need it. So we call that a plan. So that plan is compendium of services that you can access. Okay. Okay. Or
we have from package. The lowest to the highest.
Benefit package.
Okay.
So now there's no health insurance plan that covers everything. There's no such plan that exists in the world. It covers everything. No plan exists like that. Okay. So what happens is that under social health insurance, it covers a lot of things beyond consultation and medication. Okay. Okay. Under the social health insurance plan, Ilera Eko, I'm specifically talking about Ilera Eko, you have access to those things you mentioned, consultation and medication. You have access to investigations as well, both blood work and radiological investigations. Oh. You have access to surgical interventions, surgeries. Okay.
Not all. All surgeries?
Not all surgeries. Like I said, there are specified lists of services. So the surgeries have a specified list, right? But you have access to surgeries. Then for the women who are pregnant, they have access to antenatal and delivery. Okay. And then the newborn that they're just giving birth to, we also have access to some services for newborn. Okay. Then you have vaccination for children. You have growth monitoring and nutritional wellness for children. You have admission if you're sick and the hospital needs to keep you in hospital. There's in-hospital treatment. Okay. Then we have many things: physiotherapy. We have cancer care. We have dialysis. So many.
Depending on your plan.
No. So under social health insurance.
Okay.
Now, I don't want to start going back to insurance 101. Okay. So private health insurance differ from social health insurance for one fundamental reason. Okay. For private health insurance, it is based on your financial ability. Okay. So you pay and get an insurance plan based on your capacity, financial capacity, what you can buy.
What about the social one?
Social health insurance, that's not the case. Okay. Because financial equity is what we're looking at. We want everybody to be on the same level. Okay. Everybody has access to the same services.
Okay. So if you can afford more, so you'll just be directed to the private one.
Thank you.
Okay.
So, and there's a law that actually says that. So now the NHIA Act of 2022 talked about, Nigerians should have social health insurance, starting with the state mandated social health insurance. Okay. And then you can get a private health insurance plan as a supplementary or a complementary plan. Oh, okay. So what we have on our Ilera Eko is, everybody has access to the same services. If you want something higher than that, then you have to get a private health insurance plan as a supplementary plan to, take care of the extra that you don't that you might need. Yes.
Okay, you've almost answered the next question I wanted to ask. Because it's really about the vulnerable, and those include the elderly, the pregnant women or people with disabilities. Do they all have the same, treatment when they are on the social plan?
Yes, they do. So on the under 5 is the last category.
Okay, under 5. Okay.
So yes, they do. Now, like I said, financial equity is the key thing for social health insurance. Everybody, irrespective of economic or social status, will have access to the same healthcare services, right? Now, we know that there are people who are vulnerable, like you mentioned. So we have a way of including the vulnerable people into the scheme. Now, the government has what we call the equity fund, which is 1% of the consolidated revenue fund of the states. That money is paid as a first line charge, which means it's paid when it is required. Okay, and it is used to ensure that people who are vulnerable are enrolled into the scheme at no cost. So, but the first thing that has to happen is we need to first of all profile you. So the agency has a tool that we use to profile. It's called a form of means testing. We will profile to determine whether you are vulnerable.
Okay.
And you know, the profiling takes a few minutes and is 100% accurate. So it will profile you. Once you are determined to be vulnerable, then you'll be registered and then you'll be enrolled into the scheme using funds from the equity fund.
Okay.
Okay.
I'm still worried about awareness.
Okay.
I'm still worried about the awareness. So who takes the, like you said, when it comes to when it came to starting this health insurance scheme, there's something you mentioned earlier about there's enforcement and then there's, you know,
the law itself.
And the law itself. How much of awareness, you know, has a Lashma done, you know, to people or to Lagos residents to see that this is quite beneficial to them? And are there penalties if you do not subscribe to health insurance?
Currently, there are no penalties. As we speak, there are
Why?
no penalties. There will be.
Okay.
But like you said, awareness has to be at a point where nobody can say, I'm not aware. Okay. Now, the executive order that I mentioned that was released by Mr. Governor last year actually talked about awareness.
Okay.
That awareness has to be done by the agency in conjunction with the Lagos State Ministry of Health.
Okay.
So people have to be aware
that
it is now mandatory for you to have the social health insurance.
Okay.
And you know, everybody has to be told. The agency has done a lot in that regards. Okay. There were billboards that were placed all around Lagos.
Yeah.
We did jingles on radio. We did
social. Were there one-on-ones like going
into
markets?
We did road shows.
Road shows, okay.
Yes, and we did door-to-door. Apart from road show, we also did a door-to-door. What's it called now? A door-to-door awareness program. Okay. Just for people to be aware. So we created flyers that we shared in different languages. For people to know that this is mandatory. This is what the law says.
These are your options.
These are the benefits of it. You know. Yeah. So we've done this and we continue to do this. Okay. So awareness is something that is very important and the agency has taken very seriously and we've been doing it and we continue to do it. And like I said, apparently there are no penalties if you don't subscribe. Well, that is why we still have like less than 2% of the states on insurance. So because if it was enforcement, I'm sure people would have, you know, generally people don't do things unless they are forced to it. But there will be enforcement. There's a task force that has been set up for that purpose.
Okay.
But again, like I said, we want awareness to get to a point where nobody can say, I don't know about it, before that enforcement begins.
Okay. Awareness, we all know, is one thing. Public trust, you know, is another thing. What do you think? You just gave a figure, just about 2% of residents.
On insurance.
So what has been done about? Because during your awareness, you know, program, you know, road shows and all of that, did you get any feedback, or do you as your agency now derived, you know, some form of measures, you know, to find out, you know, why you still have such a low figure on health insurance in Lagos?
All right, so there are myriads of factors. Okay, people will, from the feedback we have gotten, people will tell you they can't afford it. Some will tell you that why do they need it? Because they don't get sick. Affordable. Yeah, you know how it is. Affordability is relative.
It's relative.
And then, you know, people will tell you that, you know, why do I have to, you know, use my money to buy something I will not use? I don't fall sick. That's what people tell you. They don't fall sick. Some will tell you that, you know, what would they benefit from it? That they want to, but they want to know what they will benefit from it. You know, a number of factors. And we answer all those questions.
Sorry, when they ask what will they benefit, is it not quality health?
Well, you know how it is. People will tell you, when you tell someone that you can be sick, they'll say, God forbid. You know, they will quickly reject that and say, God forbid. Until the illness actually comes, that is when they believe it is there. If it's not there, God forbid is what they will tell you.
Okay.
You know, we still have that mentality amongst the residents. So we're trying to educate, okay? people on the importance of health insurance and why everybody must be on health insurance. Okay, it is not enough for us to have, well, I wouldn't say not enough. I would say that it is not a sustainable thing for only people who are sick to be on health insurance, because it makes no long-term benefit in terms of you've paid, you use the money. That's it. Okay? When you have healthy population on the scheme, then you have enough pool. What you're basically trying to do is to create a pool of funds available to take care of people when they are ill.
Yeah.
And it means that it is the people's who pay and don't use it. It is their funds that take care of people who are ill.
Who can't even...
Who are ill at that point. Because what you pay is actually less than the value that you get.
So, yes, I get it now.
So it is in multiples of what you pay. So there's no realistic way of doing that without other people pulling revenue. So we are pulling funds and revenue together to be able to ensure that people have access to services. Since not everybody will be ill at the same time. All right?
Okay.
So when people say I'm healthy, I don't do that. But we say that there are a lot of benefits that you can derive from getting health insurance. For instance, we have annual wellness screenings.
Okay.
So even if you don't fall sick, you can screen to know how your health is. Is it okay? Is it not okay? Is there something that you were not, before unaware of, that you can now be aware of, that you can quickly address, So even when you're not ill, you can screen. That is part of the benefits of being on health insurance. Since health insurance generally, directs us towards preventive health care rather than curative.
Okay, let's look at participating hospitals now. There are a myriad of feedback from some hospitals. I'm going to give you some examples without mentioning any hospital. First, I'd like to find out how does your agency manage or regulate this participating hospitals?
All right. So, like I mentioned earlier, we work with both private and public facilities. Okay. And so we bring them into our network to partner with us and provide healthcare services to people who are on Ilera Eko. So there's certain things that they have to fulfill. Now they have to meet a minimum quality assessment criteria.
Okay.
So when you're a hospital and you express your interest to join, we will send out, we have an in-house quality team that has been trained to determine the level of quality of service that you provide as a healthcare facility. So they will come to your facility and do this quality assessment check. Now you have to meet the minimum acceptable check before we can now say, okay, you can join.
Okay.
If you don't meet it, we won't discard you. We will tell you where your gaps are and what you can do to fill those gaps, and then we'll give you a time that we'll come back to do a reassessment and see if you would, come in. So when you come in, we will put your name on our network, and then our release have a choice to pick the hospital that they want to go to, because that choice is very important. Okay, so they pick. They can also
all private hospitals, or
all private hospitals have the option of joining.
Okay, but not all of them have joined.
No, not all of them have joined. Yes, definitely not.
Not yet.
Yes, not all of them, but they all have the option of joining.
Okay.
Okay, so we will do a release. We pick, use your services. As they use your services, I always tell hospitals, when people who use your services are happy with your services, they will not only come back, they will tell others about your services. So people can decide to choose you and move from where they currently have to you because of the services that you're providing. So quality of service matters. Okay. And the thing about being a hospital on the scheme is that for you to be profitable or you to enjoy being on the scheme provider, you need a large population of enrollees. And the only way they can move to you is when your services are very good. Okay? But if people keep complaining, again, they will not only not come back, they will badmouth you when they hear somebody else wants to come to you. They don't go there, so the person will avoid you. We don't want that. Okay, so what Lashma does is we have processes and we have consequence management in place. So we share with our providers our expectation, what we expect them to do and how they're supposed to attend to our release. We share all this information with them immediately they join. In fact, we visit their facility and give them all this information. Then, of course, we check feedback with our release. So when there's a complaint, we have a complaint resolution pathway where we engage the hospital. We will find out what the problem is. When we feel the hospital has erred, there are penalties in place that we apply, and then we'll get back to you and really on what we have done, and we expect the hospital to improve. We also have a means of, recognizing hospitals who have done well, at different times of the year, by giving awards and all that, and then putting them in our newsletter, because of a newsletter, to say, okay, these are our best hospitals, and they're doing well and all that. So these are the ways to encourage the hospitals to, to continue to provide good services. And LASHMA is a listening agency, so if they have things to tell us, we are always available for conversations.
Okay, are you also thorough with the general hospitals too?
Yes, we are actually. We are actually. We knock heads quite often.
Okay. But just wanted to care.
Yes,
that,
we do.
Yeah.
But ultimately, what we want is for everything to work as it should. Hospitals benefit being on the scheme, and release are happy being on the scheme, and the scheme continues to grow, evidenced by increased number of people who are enrolling onto the scheme.
Okay, I'll be bringing in, because we don't have much time, I'll be bringing in case scenarios now from some of my observations at some of these hospitals, and of course those with HMOs. I often notice that when you come in as an out-of-pocket patient, they tend to you better than those with HMO. They normally delay them, and at the end of it all, sometimes they'll tell them to go back and clarify with your organizations. We've also, had cases where some organizations will deduct from source, and do not remit, this fund. So where does LASHMA now come in when you get such reports? All right.
So for enrollees on Ilera Eko, we have zero tolerance for some practices at hospitals. Treating our enrollees differently because they're not paying out of pocket.
Exactly.
It's zero tolerance for us.
Okay.
When we get report of such, we investigate. We don't just take people's word for it. We investigate. If we find the hospital to be culpable, there are penalties and sanctions in place. Okay. Now these penalties and sanctions were signed by the hospital at the time they were joining, and they also have copies of it. So it's very clear. There's no ambiguity about it. This happens, this is a consequence. Simple. And there's a grading level of consequence. So the penalties increase the more you repeat that offense until it gets to a point where we remove you from our network. We delete you completely, because it means you don't want to be a part of the network. But like I said, we always try to engage hospitals, because we do quarterly engagement of our hospital. We try to meet with them every quarter to talk to them about, okay, how are you doing being a provider? What is going on? Do you have issues? How can LASHMA step in to help and assist? We have these regular conversations. Even outside that, those meetings, we also are available for them to hold conversations when they want. So that's why we have zero tolerance for these things. So that if you do that and we find out, of course, enrollees will report to us, because we have channels of complaints, and then we investigate, and you are found culpable, we apply our sanctions that you have agreed to. Okay. So, there's nothing else we can do about it. So we keep letting you know that, look, for every action, there's a consequence. So you can't just, misbehave while you're on the scheme. There are obligations for you as a provider, just like there are obligations to LASHMA as an agency. As an agency. Exactly. So it goes both ways.
Okay. What about organizations that do not remit?
For the health insurance?
Yes, funds. I give an example, like a staff of an organization gets to the hospital for treatment on HMO, and they tell them, oh, sorry, you can't clarify with your organization, and because of lack of funds coming from them, is there anything, or is there any penalty for that? Because I have also seen that.
Yes, I know. Okay, so I don't think the agency has the power to do that, because what happens is an organization will have to go into a contract with an HMO for them to provide some services to their staff. And then they will pay ahead for those services, and then the staff will choose hospitals where they can go and access those services, right? So if they are deducting from the staff and not remitting to the HMO, it means at that point the HMO will not have any contractual obligation to that organization. Yes, to give access to health services to their staff. So it's now, I don't think LASHMA has the powers punish an organization like that.
Okay.
I'm sure that the staff might maybe pass the information to the NHIA.
Yeah.
I don't think Lashma has that power. I can check, but like
Okay.
I said, I do not think we do have that power here.
Okay. So just finally, before we go, what message do you have for Lagosians who are still undecided about health insurance?
Okay, so the first thing is health insurance is beneficial. Okay, nobody plans to be ill or injured, but when you do have those things, it might be at the point where you have no money to pay for healthcare services.
Okay.
So what do you do then? If you don't have money for Ashwebi, you can decide not to go. But if you are sick, you cannot not go for healthcare. You
go
have
to the hospital.
All right. So that is what it prevents. It reduces the costs that you spend going into the hospital. Apart from that, it is a law. And the law says it is mandatory for you to have health insurance. So you cannot not obey the law. If you are not obeying the law, you are breaking the law, okay? And we don't want to be lawbreakers, do we? We want to be law-abiding citizens of the state. So I'm encouraging everybody to, subscribe to Ilera Eko, right? It is beneficial. When the scheme grows, you improve the services on the scheme and strengthen that system. Okay. So it's only going to get better when more people use it. Yes.
Thank you very much, Dr. Olugbenga Fadipe, for shedding light on operations and impact of the Ilera Eko scheme under LASHMA, which is the Lagos State Health Management Agency. We'll have to go on a break now. When we come back, the conversation continues.
I see a burial ground, we call it Teku, that were kidnapping people's school children. So when I woke up in the following morning, I was afraid of coming to the school. So by the time I passed this place, I don't know. When I get to the other side, I remember that I've just passed through Teku. I just started running to school.
Let the conversation continue.